This conference will now be recorded.
All right, so it should be going. And I'm going to read our public meeting document here. Thank you for joining us today. This is the Live Well Kingston Commission, as I mentioned. Today is July 17th, and my name is Emily Flynn. I'm the Director of Health and Wellness for the City of Kingston, and I coordinate the Live Well Kingston Commission. Before we begin, I'm just going to go over a few things. What's that, Lori?
Today is July 15th. Today is July 15th. I think you said 7th.
I did. I said 17th. Thank you. I was just checking to make sure that everyone was paying attention. Thank you for that. It is absolutely you caught me. We asked that the members of the public, let's see here. We asked that the members remain muted for the length of the meeting. As the organizer, I reserve the right to mute anyone and unmute who unmutes themselves. Commission members and city staff will control their own mute buttons. Let's see. Good practice would be to mute yourself if you're not speaking to avoid background noise and feedback. If participants wish to speak, they will raise their hands. This is also, you're welcome to kind of jump in on our meeting today. Both video and written transcriptions will be made available to the public on the city's website at a later date. If you have any audio issues, you can text me at 914-646-0763. I will repeat this number again. I won't be able to answer phone calls during the meeting, and I will try to address any issues, but while I'm sharing, it's very hard to do that. Again, my number is 914-646-0763. I reserve the right to lock and pause the meeting to eject anyone who has behaved inappropriately. And then I want to kind of go into some introductions. So let's see, Doug Coop, you're in my top right-hand box. Would you like to introduce yourself today?
Hello.
Thanks, Doug. I just want to mention that you're an alderman for the city of Kingston.
Yeah, second ward, uptown. The great second ward.
Thank you for that. Katrina, you're next. Would you like to introduce yourself?
Sure. I am Katrina Late. I am a program manager for community food at the Hudson Valley Farm Hub, and I'm here today to talk a little bit about the Kingston Emergency Food Collaborative.
Thank you for joining us, Katrina. Anna, you were next on my screen. Would you like to introduce yourself?
Sure. I'm Anna Brett, and I'm one of the commissioners on the Live Well Kingston Commission, former educator for Kingston City Schools.
Thank you, Anna. And Lori, would you like to introduce yourself? You're muted.
I am Lori Ferguson, and I am a nutritionist and a nurse, and I volunteer at People's Place. And I was working as a nutritionist for CCE before the pandemic.
Gotcha. Thank you for that. And finally, Melinda, would you like to introduce yourself?
Sure, I'm Melinda Herzog. I work for Cornell Cooperative Extension and the Healthy Communities Program Leader there.
All right, thank you. So we have 3 commissioners with us, so we don't have a quorum at this time. If more commissioners join us, then we'll be able to do some more motions and those things. But we still have lots of things to cover, so let's go forward. I'm going to call this meeting to order at 4:11. And first up is a Playwell report. So I will speak to just a few things about Playwell. I'm going to put in the chat box a link to the Playwell action plan. If you have the ability to look at that while you're on this meeting, feel free. If not, I'll try to speak to it as we go along. I'm not going to try to share my screen this time. That didn't work out so well last time, but I can talk us through it. So top level about Playwell, what's been happening in the Playwell world is we've met once since the COVID pause, and we met in June, and we reviewed the status of available programming and parks. We talked a lot about the increase of usage of parks. We also talked about how some people have not been wearing masks, and some of us were a little bit concerned about mask use at public parks. We talked about putting our chess programming on hold at this time. We had been talking to CCE and trying to come up with a plan to maybe do some chess programming at the chess tables down at Tierra Gallo Park. We've put that on hold for now. We identified some communication topics that we would like to do through the Live Well Kingston channels. So promotion of walking, promotion of using public spaces in this time, some other communication topics that we're going to do. And then kind of a new project has come up. The Kingston Library has expressed an interest in a program where they might do a decorative sidewalk project. And the idea was that if we connected with other organizations in the city of Kingston, like the Center for Creative Education, the Boys and Girls Club, the YMCA, many of our other programs, that they would also kind of decorate in front of the sidewalks in front of their organization. And maybe it would be like a treasure hunt or an activity group. And we would like advertise for all of the organizations and children. It would be focused on children, but maybe people of all ages could participate. And the idea would be that you would visit each location to participate. So that's kind of a fun project that's on the radar that we're starting to talk about. It's in the very beginnings of it, but the library kind of initiated that. And then I brought that information to the Age Well group this last week, and they got very excited about it and wanted to maybe try to incorporate some walking programs for seniors. So we'll see if this initiative grows. Let's see what else I can tell you. So that's kind of the top level, what's happening in Playwell right now. If we look at our action plan, I've tried to kind of update it a little bit to show what has been accomplished and what has been paused. As I mentioned, a few of our programs and projects have paused. A few others are, we had started to talk about the Community Preservation Act. That would have been a program that would have added a bit of a tax to real estate when different properties were sold. Would have been that funding then goes into kind of reserve fund to support public spaces or just public programs. That initiative has been completely put on pause because of COVID and financial restrictions. So we're not going forward with any conversations about that initiative anymore. We had been talking with TFAC about a tobacco-free parks event that's been canceled due to not being able to get together in person. We may take that up again, but unfortunately now TFAC, which is tobacco-free, I don't remember what the A and the C stand for, they are unsure of their funding at this time. So we may not be able to partner with them about a tobacco-free event. We're still going to support the Kingston Parks and Rec Department. And then some of the things that I mentioned are, we're going to still encourage play for all ages with the sidewalk event. I want to mention that I went to the Office for the Aging's game day on March 3rd, way back before COVID, and I tabled there. That was a great event. So it was fun to see the seniors playing board games. We loved supporting that. And we have a list of organizations that we'd like to reach out to get some more participation in Playwell. That kind of concludes my Playwell report. Does anyone have any clarifying questions or suggestions or thoughts around Playwell? I'm getting a thumbs up from Doug. Thank you, Doug. All right, I'm going to move on. If anyone has any questions about that, I can always come back to it. So we're going to put that Playwell report into our documents, and that'll be good. Next up, I had a report about the Kingston Emergency Food Collaborative. I wanted to keep this on our agenda for a couple of reasons. One, there's still a great need in our community for food support. And secondly, it's taking up, I'm still supporting quite a bit of it. A lot of my time is going towards it. So I wanted the commission to be aware of the work that's happening there. And I've invited my colleague, Katrina Light, who I've gotten to know quite well through this work. She's been a very close partner of mine in supporting the Kingston Emergency Food Collaborative. And I was hoping that she might be able to give a little bit of a overview of the work that we've been doing. And that's it. Katrina, would you like to start that up? And I can jump in if you have any questions.
Sure. Yeah, we can definitely tag team it. And if there's any questions as we go, please feel free to either put them in the comments box or shout them out. And also my internet's been a little weird today, so flag me down if I freeze. So I know when to stop. And I know some of y'all are familiar with the Kingston Emergency Food Collaborative, and has anyone not really heard about this initiative? Yes is thumbs up, maybe no is thumbs down. We got a thumbs up from Lori. Oh, I can't hear you, Doug, you gotta unmute.
Sorry, what was the question?
What your level
This
of
sound didn't come through awful good, so please go ahead. What was the question?
I'll try to go slow too. I'm just asking kind of your level of familiarity with the Kingston Emergency Food Collaborative, so I know how far to go back. Okay.
Not very familiar.
And Melinda, I know you've been on some of these calls. You probably know what's going on. All right, so I'll just do a quick overview and like history of how this even got started. Basically, our first call was early March when we realized that schools were going to shut down. And so a call was formed with folks from the city, like Emily, people from CCE, from the Farm Hub, from Land to Learn, just anyone who kind of had some sort of connection to food in Kingston. And really what we started talking about was what happens if schools shut down, what happens to the kids who get all of their, or most of their food from school food. Are schools still gonna provide this service? If everyone has to stay home, how is the food going to get to them? So that's really where we started, just again as a phone call. And then I'm looking back at our timeline, and within a week, we kind of sprung to action. So our first kind of direct service was on March 18th, was our first delivery of food. And that food was coming from the Everett Hodge Center, who's already been providing food for a very long time. What they hadn't really been able to do is to deliver that food. So our network, our coalition came together to figure out that piece. How do we get food to people in their homes so that we can help stop the spread of this disease? So Emily, do you remember how many people that first day was? It wasn't very many.
Yeah, I think it was like 175 or 175 meals, but so less people. Yeah.
175 meals that first day. And folks were finding out about us through the hotline, through the Everett Hodge Center. So they were calling Family of Woodstock and saying, we need help. Quickly within the coming weeks, we established our own hotline. So for Kingston, anyone could call who needed food. That was kind of the only requirement. We didn't do a lot of like question asking. You need food? We'll get you food. So that first week, our numbers kind of went up pretty quickly. Our delivery site was the YMCA. And I think within the next week, the Project Resilience within the county kind of came to action. And what they did was they were able to pay restaurants to produce food, and that food then could come into the YMCA distribution site, and then our volunteers could get that food out to the community. So yeah, it started with the Hodge. I think Savona's Pizza was one of our first folks who were making us food. Wildebeest, it was kind of like a hodgepodge crew. And then within the coming weeks, there was like over 100 restaurants that were involved. Is that the right number? Yeah, so the county was organizing the restaurants and making sure they got paid and were able to keep their employees as well. So I'm just gonna fast forward. So we're now in like March, April, May, June. We're in our 5th month. Wow, time flies. So over these past 4 or 5 months, we have distributed 617 prepared meals. So at our peak, we were doing 5 days a week so one family would get 5 days a week of deliveries, and they would get 2 meals each day. So where we look at some of our county counterparts, other municipalities were looking at like food day or 2 times a week. We were doing it 5 days a week and 10 meals per week per person. So it was a pretty big undertaking, and quickly, Emily was at the YMCA on the ground. It can speak to how many people it took, and like it was kind of like a factory. Like everyone had their role. People were packing food. We had outside refrigerators. We were social distancing. We had drivers come up in the car. People pack those cars. We had different shifts. There was a lot going on. And what I didn't mention is that the second week involved, we started doing grocery deliveries as well. So we quickly realized, yes, prepared meals are great. We all want, it's nice to get a hot meal, but also groceries can last us a lot longer, and they're more sustainable with packaging, and people have more agency in what they're cooking for their families. So People's Place, as always, was just on it, and Christine agreed very quickly to, yes, she's like, you guys deliver, we'll pack the boxes. And again, I think our first day was maybe 30 families, and then our second day was 60 families, and at our peak we got up to 5 days a week, 90 families a day. And so those numbers, yeah, we have done now over 4,800 deliveries to families. And we had to expand from People's Place, and we went to Community Action as well as Catholic Charities in the Rondout. So those are our 3 providers of groceries for the city of Kingston. And I have to say, it's not just the city of Kingston, it's the Kingston City School District. So we do have delivery drivers going out to Saugerties, Sopus, kind of the surrounding areas as well as Highland. We have anyone who got placed in motels, we're also servicing. So yeah, our numbers currently, Emily and I went back and looked through all these spreadsheets and realized that we have served over 1,200 families in this area, which totals about 4,306 people. So lots of children. People's Place was doing a special box for kids, trying to supplement what folks weren't getting from the schools. And we have been working with the city school district as well. They had 3 sites open. We just quickly realized that they weren't serving the same amount of people they were previously when school was in session. So we were able to supplement some of that. When we calculated all the meals we've served between groceries and prepared meals, we realized that number is over 305,000 meals in the last couple of months. So I think that's something that as a city, we can be really, really proud of. There's lots of other folks now reaching out to us, like, how did you guys do that? How did you do it so quickly? And I have to say the key was partnerships and collaboration. The fact that this is a coalition, this is over 10 organizations dedicating their time to making this happen was amazing. A lot of staff time was kind of given over to this project. And I think that really shows. And it was, people kind of picked up what they could do. We created a whole back of the end system to keep track of everybody. There's a hotline team. The volunteer team managed over 600 volunteers. So, as some people are staying home, other people are getting out there and helping other folks. It was just very, I can't think of a better word than just heartwarming and inspiring to see everyone spring to action. Even if you had to stay home, people were like, oh, I can volunteer my time scheduling other volunteers. So it really was this huge collaborative. and we're planning on continuing. It's changed a lot. We have bi-weekly meetings or two meetings a week, and there's, you know, a handful of us left who are still doing a lot of the work. You know, obviously we're still doing a couple prepared meals. About 30 families are still getting prepared meals from the Hodge Center. We've had to scale back. We're about 120 families still getting grocery deliveries. And we're really seeing that those families are folks who have disabilities, the elderly, people who've been placed in boarding houses, motels. So these people existed before COVID and they exist now. And so now we're starting to turn our attention to longer term systemic issues and how as a collaborative we can address those. And it's wonderful to have people from different sectors, work sectors, kind of take on a problem and look at these challenges together. So that's where we're at now. I want to make sure you guys have time to ask any questions, or if Emily wants to jump in, if there are things I missed.
Sorry, and I think we should mention the end dates. You know, so the Hodge has committed to continuing this smaller amount of meal delivery until August 14th, but we do not have a plan for prepared meals after that date. And my understanding, Katrina, the Groceries ends August 20 something.
26 at Catholic Charities. It's ended at Community Action, and People's Place will continue to provide boxes for delivery as long as we can provide volunteers through the end of the year.
Thanks to People's Place, they're remarkable that way. But we do also want to mention that our understanding is that unemployment will end soon, and there's an expectation of need coming up. There has been some SNAP benefits that have been distributed, but those also have a sunsetting date soon. So we're also in the Kingston Emergency Food Collaborative kind of having conversations around if the curve starts to come back. So we're a little bit concerned about we might have to do this all again, and if so, where would we find funding and or how would we provide those services? At least this time we have a game plan. You know, the first time we did it, we were making it up literally by the hour. So at least now we have the relationships and a system in place. But I do just want to flag the fact that we're trying to plan for the worst and hope for the best in terms of food security in the city of Kingston. Yeah, so now is a great time for questions. Does anyone have any clarifying questions or thoughts?
What was the major, where do most of the groceries come from? The groceries, where did?
Yeah, so the distribution sites I mentioned were People's Place and Catholic Charities and Community Action, but the groceries themselves,
Still, right?
Right, so the groceries themselves are coming
What was
from.
the original source of the groceries? Was it the major chain or?
No, so traditionally a lot of, we're getting things from the food bank. So there's a couple different food bank sites for this area. And so those food banks have been working with these emergency feeding services for many, many years. What did change during this time is where they were getting their food. So because there was such an increased stress on grocery stores, like a lot of grocery stores tend to donate to food banks. But because the grocery stores were running out of food in the beginning, they had to kind of go into the vaults. And so they were getting food from other places, lots of canned food. And so the Emergency Food Collaborative also had a procurement team, and we were getting donations from local farmers. So we had a GoFundMe, and there was about $10,000 to kind of support farmers selling into this collaborative, as well as a lot of support from the Hudson Valley Farm Hub. So within my community food department, we actually reallocated our entire conference budget and all of our all the events that we were going to have to cancel. We put all of that money into procuring food to then pour into this system. So we were able to supplement a lot of that food with and a lot of fresh vegetables. So every week the box, in addition to kind of what you picture as like emergency food, like canned and dry milk, people were getting broccoli and fresh meat and eggs and milk. And we're really hoping to kind of keep people's diets healthy and have a lot of options.
It's alarming that so many people are going to fall off unemployment all at once. Probably within a 2-week period, you're going to have 80% of the people go down to nothing. So that's going to really, I mean, are you still going to be able to sustain this effort?
So that's kind of what the challenges are now. I would say one of the major challenges has been our volunteer numbers. So at the height of this, we're delivering 5 days a week from multiple sites. We probably have, I don't know, probably over 50 volunteers a day. Now we're down to maybe 50 volunteers a
How
week.
many?
50 a day.
Did you say?
And now we're probably around a little less than 50 a week that we need.
Yeah.
And because a lot of people have gone back to work. And so I worry about that. If we have to kind of amp things up, where is the funding coming from? We were really lucky that there was a donation made to United Way. And so they've paid in million, like over $1 million has gone into this program. And the grocery boxes are still being subsidized. So every box that goes out to delivery is People's Place or Catholic Charities gets $6 a person. So it's helping kind of offset their cost because they've seen like a 30% increase in need since this started. And you're right, it's going to go up again. And so where is that money going to come from? Where are the volunteer hours going to come from? These are all things that we discuss in kind of our long-term planning.
Any other questions or clarifying points at this time?
Just an impressive effort. Thank you.
It's been pretty amazing to be a part of and to see what we can accomplish when we all work together and kind of come out of our silos. It's inspiring.
All right, thank you so much, Katrina. Thank you for giving us all those numbers. I think that's really good for us all to hear. And I wanted to make sure that we recorded it here and had it kind of memorialized through the city. So thank you for that.
And hopefully there's going to be a press release soon that'll go out so that our community kind of realizes what happened as well. Because we're looking at those numbers and we're like, wow, that's almost 20%.
I do have a question.
Yeah.
So the question really is, and let me know if my internet's really bad too, I can turn my video off. The question really is about the distribution of the food. I just wondered if normally when there's food distribution, we don't really take names or contact to keep information private. But I just wondered if there was any attempt to do that so that there could be a follow-up survey to see how this met their needs and how to change things as we go into the future, because it does seem like this is going to reappear in the fall.
Yeah, that's a great question. We have a database called Zendesk that we've been using. And so we still have everybody's contact info. And we have also talked about privacy and confidentiality. The Slack channel, and there's things that we can improve for sure. And we do, want to take people's privacy seriously, but we also have been sharing info between the distribution sites to make sure that we're kind of creating an ecosystem where everyone has the same amount of access. But yeah, we just did a follow-up with all of our volunteers. So all 600 volunteers got a survey of how their experience was. And I think that's a great idea to do the same thing with participants. The only tricky thing is, like, for a while when we were making all these new systems, there was a lot of hiccups as far as like duplicates. And so we have like thousands of people in our system that we just need to kind of sort through who we actually served and who was maybe a duplicate or a mistype. We're also sharing information with the county. They would send us these long spreadsheets. We're merging spreadsheets, but we've learned a ton and we have a pretty great system now. So that's good.
Any other questions or thoughts? All right, thank you, Katrina. Thank you so much. Next up on the agenda, I had approval of minutes, but we still don't have a quorum. We'll have to postpone that for next time. And honestly, the next thing also after that is administrative matters, which is our open commission seat. So unfortunately, we won't be able to make any movement on that either. We did have a number of applications, and I do sense, so let me first address that. Shai joined us last time and she introduced herself, and she has been in regular contact. So I just want to keep her name just want to remember that she has expressed a lot of interest. So hopefully we can take that up next month. This is new information since I made the agenda, and that is one of our commissioners has stepped off. Kathleen Rogan has stepped down. She expresses her regrets that she's not able to join us tonight. She had some family things come up. She stepped down. I think she'd been thinking about it for a while. If I can interpret it, I think her thoughts were that she felt that she wasn't making as big of an impact in the community as she had hoped, and it plans to still participate through Play Well and still do some of that real actionable items through that channel. But she felt that as a commissioner, that maybe her seat could be better for someone else. She kind of felt that it wasn't the perfect fit for her at this time. So I sent her the exit interview questions that we have developed to try to capture some of the information about what we can do better. And hopefully she will return them to me. So we now have 2 open seats on the commission. I will go forward with what we're doing right now. It's kind of weird COVID times. I'm disappointed by the number of people that we're not getting all of the commissioners to join us. I know things are chaotic and tough right now. Unless anyone else has any suggestions of what I could do differently, I'll probably keep doing what I'm doing. So any thoughts about how to increase participation or thoughts about how to move forward at this time?
So, Emily, it's not so much on how to increase participation. Can you hear me?
Yeah.
Yes.
So it's not so much on how to increase participation. It's more if I recall, the bylaws might actually include something where we might be able to vote without being at the meeting to get this new person in so she can join at the next meeting. Am I wrong on that?
I actually thought that with public meetings, maybe Doug can illuminate. I thought with public meetings, we weren't able to do votes by email because of the public meetings law. Doug, do you know anything about that? I'll try that question again. So I'll say, I'll look into it, Melinda. I didn't think that we were able to do virtually by email. And I thought that had something to do with the open public meetings law. But I'll look into that for next time and have a better answer.
All right. Yeah, okay.
Thank you for that feedback, Melinda. I think part of it is just the tough times right now. So I really appreciate those of you that have showed up today. I really appreciate your time and your going through with technology. I really appreciate it. So then we have next on the agenda, old business. I'm gonna go past the community agreements. We've talked about this quite a few times now, and we can't go forward with it at this time. So I'm gonna move forward unless anyone has any specific questions. I wanted to mention the urban ag group that was considering being Grow Well is still considering it. They're still trying to come up with their goals and how they envision themselves. So at this time, my update is kind of a holding pattern. They're still interested, but no real movement there yet. Next up on the agenda, I had the Undoing Racism training that I brought up at our previous meeting. I wanted to give you an update on that. I've reached out to a few organizations. I think the good news is that they're very busy at this time. Many people are reaching out to them for Undoing Racism training. I took a couple of webinars and got many great little nuggets of information about how to start creating organizations that consider racism and consider how to undo racism. And one of them was that that people should do individual work on breaking down a racist system in terms of their own lives before they come together in a training. That sometimes if you haven't done some of that pre-work, when you come together, it can actually be quite traumatizing. So the suggestion was to kind of challenge people to do a little bit of work before they come together. So what I loved was Rough Draft had already started this program with the librarian from the Kingston City School District to read So You Want to Talk About Race by Iojima Oluo. I'm not saying her name right, but I'm trying. And what I loved about that was that we could continue in that. So I have asked everyone to read that book, and I have ordered 25 copies, which I will distribute to everyone. In fact, once I get confirmation from Rough Draft, I'm gonna encourage you all to go and pick up a copy at Rough Draft directly, so I don't have to distribute it to everyone. That said, of course, I will get it to everyone if they're not able to get to Rough Draft. So quite a handful of focus team members and commissioners expressed interest in getting a hard copy of that, so I was very excited to move forward with that. That all said, I still plan to look for trainings for our commission. So to be continued on that conversation. And that brings me to the end of my old business on our agenda. Next up was new business. It's open. Do any commissioners have, or anyone here on this call have anything they'd like to bring up for new business today?
Yeah. I would like just to make mention, you know, we had a meeting 2 or 3 months ago, and I can't remember her name, but she spoke very passionately and convincingly about the dangers of wood burning fireplaces. And, you know, in Kingston, there's a new pizza restaurant that has opened up right across from the county building, which uses wood burning, stoves to produce pizza. And that particular building, on either side are 2 other buildings into which the smoke pipe is putting all kinds of fumes. And so as the alderman for that area, I've gotten many complaints, and it basically has been shut down pending the owner getting new technology to come in there and take care of that smoke. It was even setting off smoke alarms in a county building. So, and as you come around the corner from Main Street on Fair Street, you can immediately smell it. So it was very horrible. So I don't know if anyone's heard about this, but hopefully there'll be a fix to it. And it's I mean, everyone likes pizza from wood burning fireplaces, but this is right in the middle of the city. And it's really caused a big problem. I mean, it goes into residents' apartments that don't have air conditioners, so it's terrible. So basically, a building department has been there 2 or 3 times. So I hope there's a resolution to it. It's really maybe not even belongs on the agenda of this meeting, but I just thought that you'd like to be aware of it.
Yeah,
That's
you
it.
know, clean air is definitely about being able to live a healthy life. Yeah, absolutely. And what you said in those, that there are tools or ways that they can set up their system so that it is not so bad for the air, is my understanding. So hopefully that they will be able to do that. Is that correct?
Yeah. I mean, the new piece of hardware that they're talking about, I don't know whether it's a precipitator or what, but the smoke is coming out of a pipe which is below the window level. So smoke rises and it goes right into the windows. So I'm not sure about the fix, but it's, that restaurant owner's got a lot of investment in that building. And it's pizza only. And it's, you know, it's kind of an upscale restaurant, an upscale pizza, and draws a lot from the county building at lunch and the lawyers and so on and so forth, all the uptown people. So, you know, it's a balance between the health and particularly for apartments, buildings, or businesses. Academy Insurance is right there. So we're working on it.
Thank you for that update, Doug.
Okay. Okay.
Next up, I had announcements and communications. Anyone have any announcements? I guess I can announce that Freddie Garcia from Health Alliance Hospital will give us an update next month about the hospital's, kind of an update about where the hospital's at this time. So I'll add that to next month's agenda. Let's see, also on here I have our upcoming focus teams and other events, and I want to mention that the Bike Friendly Kingston slow rides are happening every Thursday night, 6 p.m. at the YMCA. They're safely distancing and wearing masks when they can. So that's kind of what I have on announcements. Anyone else have announcements they'd like to make? Well, all right. Hearing none, I'm gonna say that we should adjourn. I guess I don't make a motion because we're not at full quorum, but I'll say that we are adjourning early tonight. And again, I thank you all for joining me, and it was nice to see your faces and hear your voices. And hopefully we'll be able to see each other in person soon.
Thank you, Emily.
Yes, thank you.
Good night,
Thanks.
everybody.
Bye.
Good night.
Thank you, Emily.
Thank you, Lori.
Good night. Okay, you're welcome.